So the technique for utilizing amniomatrix, we're going to first look at the wound, and the secret is to do a very aggressive debridement, not only of the hyperkeratotic tissue, but we want to get off the dermal ring as the dermis rolls down into the wound. We want to take that out and create almost like a beach sand. We want a shallow margins, not a sharp drop off. Once we have achieved that, and we have gotten debridement of the entire wound, including any sinus tracts or tunneling, we then want to take some Tegaderm and cut it so that it is overlapping the wound by about a 1 centimeter margin. And this is a little too large, but if you can see the little inner square, that's what we want to. That's the only portion of the Tegaderm we want to leave on here. Once we have the Tegaderm in place, we'll keep it a bit compressed. We'll then take a syringe, and we'll take the vial of amniomatrix. And so typically we're going to use a 1-to-1 ratio. So if we have 1.25 milliliters of amniomatrix, we want 1.25 milliliters of 1% plain lidocaine. No epinephrine, no glycerol products. So we take our 1.25 of the lidocaine, and we take the top off. Make sure not to shake the vial. We don't want to have any of the matrix in the orange cap. We're going to take our needle cap off, take our 18 gauge needle, and we're going to drop in a couple of drops of 1% lidocaine and swirl it around. We can continue to do that until we have the vial filled up to its first marking where it says 1.0. Once we have it nice and swirled, it's fully defrosted, we'll then aspirate out, slightly tilting the vial, bringing in all of the amniomatrix and lidocaine into the syringe, and we'll bring it back. We'll change out the 18 gauge needle for a 23 gauge needle. Nothing smaller or thinner than a 23 gauge needle, otherwise the cells may be lysed and you'll lose the effect. So now we're going to look at the wound as if it was a face of a clock, and on the margin about 1 centimeter from the wound edge we start at 12 o'clock and we go below the fascia, which is about 10, maybe 15 millimeters. And now we're going to direct the injection to almost the hub, and we're contouring around the wound. So we're coming around the edge of the wound, and now we're going to flare and drop a little aliquot of fluid and fan it around, but we don't want to be aiming into the wound or under the wound. We just want to be on the periphery of the wound. As we do that, and now we come up, and we're going to redirect more proximal, and we're going to follow the same technique. We're going to follow the margin of the wound. We'll drop a little bit of the amniomatrix in a fanning type manner. And now as we're ready to withdraw, we're going to aspirate, and then we're going to pull the needle out. And there's two reasons for this. One, that we don't lose any of the graft in the tip of the needle, and second, that we don't have leakage at our injection port. We're then going to do a second point, again at 3 o'clock position, and following the same technique that we did at 12 o'clock, we're going to fan and disperse the amniomatrix. We're going to withdraw and then go inferior, again following the margins of the wound. And moving around the edge of the wound. As we do that, and again we're going to aspirate and withdraw, and then we're going to do the 6 o'clock position. Again, following the contours of the wound, we're going to follow it distal, withdraw, aspirate, proximal, and then again at 9 o'clock position. Once this is completed, we're then going to put a Telford dressing, compression dressing, and good nutritional control, good glucose control, good offloading, and we will see the patient back 2 to 3 days, At that point, we'll remove the dressing, remove the Tegaderm, and start our traditional wound care. Typically, we can just use Solucyte and a Telfa dressing and change the dressing daily. At day 21, we're going to take the patient back for an aggressive debridement and administer the second dose of the AmnioMatrix. Typical dosing is 1.25 milliliters for wounds up to 25 square centimeters, and then anything over 25 square centimeters needs an additional 1.25 milliliters of AmnioMatrix. And we typically will repeat dosing every 21 days. The mean for number of doses for wounds under 25 square centimeters is typically 2. For wounds greater than that or with a greater depth, may require 3 or 4 injections.